I talked a little bit about the pediatric office and a little bit about what makes a good pediatric dental assistant. Now I want to focus on the pediatric patient, and this is going to be true, especially with a pediatric patient, is you want to treat your patients the same. You don't want to single anybody out for maybe the way they look, the way they act. Maybe they have some sort of mental disability or physical disability. Again, we want to be respectful towards them and again treat them the same. We're going to do the same thing with our pediatric patients. We're going to talk with them. We're going to listen to them. We're going to probably have to do a little bit more motivating or coaching with our pediatric patients. So patience is definitely going to be a virtue with it when it comes to dealing with a pediatric patient. But again, just want you to keep that in mind, that we need to treat everybody with respect and dignity when it comes to how we handle and talk with our patients. One thing I do want you to know is there are things that we need to take into consideration, and this is going to be true whether we're dealing with a pediatric patient or not, but more so when we are dealing with a pediatric patient, we want to take into account their age, and that's going to include their chronological, their mental, and their emotional age. So their chronological age is going to be referring to their actual age. So if they have a birthday on this date, then they're this many years old. That's going to be chronological. Mental is going to deal with their intellectual capacity or their development, and their emotional age is going to have to do with their behavior. So let's say, for example, we have a 10-year-old boy sitting in our chair. That would be his chronological age. He's 10 years old, and we know that by looking at his birth date. And we're talking with him, we're letting him know what we're going to do. He's asking really good, intelligent questions. When, you ask him, do you understand? Are you okay with what we're going to be doing? He's, saying, yes, I understand. So you're going to do this, this, and this. So his mental age is that one that's beyond what a normal, typical 10-year-old's mental age would be. He's very understanding. He comprehends what's going to happen. He's asking really great questions from you. So his mental age is maybe a little bit older than what his chronological age would be. So let's say we start to get started in the process. We start to lay him back. He starts to become, a little bit more combative. He doesn't want to comply. He is somewhat throwing a tantrum. So he's acting a little bit more like a 4 or 5-year-old might be acting. So that would be his emotional age. So his emotional age does not fit with his chronological or his mental age. So we have to make sure that we are aware of that and have the tools necessary to be able to effectively communicate with our patient to maybe get him back to a place where he's feeling comfortable and he's feeling safe. And we're able to get done what we need to get done when it comes to the treatment. So again, you're having to balance between all of these different things to be able to identify, to properly assess what's going on with your patient, and then how to try to gain control again and get it back to a situation where it's going to be a little bit more manageable and you're able to get the work done. Another thing to take into consideration is going to be Erickson's stages of development, and this is typically used kind of more as a guideline to get a sense for the child's behavior level when it comes to certain age groups. And there's going to be 5 stages to Erickson's stages of development. I'm going to talk about these individually. First one being the learning basic trust. This is going to be typically from infancy through the first year of this child's life. During this time, they're able to establish trust with an individual or a parent, assuming that they're being treated appropriately. So it's all going to depend on, situations within that child's life. But, at this age, they're starting to feel nurtured. They're feeling loved. They're feeling like they're able to, have that trust and that security within their parent or whomever is caring for them. On the flip side of that, if the child is not being handled in an appropriate manner, or there might be some sort of abuse going on, then at this stage, it's, the child can start to develop some insecurities as well as not being able to trust people. So this is a very important and crucial part of a child's life, is this learning basic trust stage, because this kind of helps to shape and form what's going on. So if they are being mistreated in a dental office around this time frame or this age, then they're going to be very impressionable, and that experience is going to stick with them for a very long period of time. The next one is learning autonomy, and with this one, they are starting to begin to have a little bit more freedom, or being able to do things on their own a little bit more. So this is typically around the age of 2. So they might too even start to develop some anxiousness or being fearful of and being aware of their parents leaving. So they might be have some sort of separation anxiety that goes along with it. And at this stage, even though they are becoming a little bit more independent, when they're in the chair with us, it's important to have the parent with the child in the room with them, so that they feel a sense of security and trust with what's going to happen and what's going on. Even though they are starting to develop a sense of independence, again, they still need to have somebody in there that's going to be very familiar to them, and it's going to help make them feel a little bit more comfortable. Next one is going to be the play age stage, and this is typically around 3 to 5 years of age. They're, again, becoming more independent. They're starting to take initiative with things a little bit more, starting to develop a little bit more control and structure. This is, an age where they're able to start making decisions. So parents might, ask them, what would you like to eat? What kind of toothpaste do you want when they're at the store? Do you want the mint? Do you want the bubble gum? So they're able to make some decisions. So with this one in the dental chair, they need to have simple directions. I need you to sit still. We're going to do this. I need you to open real wide for me, open wide like an alligator. Let me see those teeth. So you're kind of having to maybe coach them a little bit more and provide them with a little bit more direction, so that they can go ahead and do what it is that you're wanting them to do. The next one is going to be school age, which is typically around ages 6 to 11. This is where they learn to start getting along with others. They are now being socialized and being introduced and being able to play with other people. They're being able to understand some simple rules, and to make sure that they're following those rules and the importance of following the rules. And with this one, they're a little bit more independent than they were before, and they aren't going to be as afraid. So typically at about this age, they can start coming back into the treatment room by themselves, or with a sibling, and be okay, feel comfortable. And again, that's all going to be kind of put on you as the assistant to make sure that you are making your patient feel very comfortable and secure when they're being taken back. The last one is going to be adolescence, and that's going to be about the age of 12 to 20. They, at this stage, acquire some self-certainty, so they're a little bit more sure about what's going to happen, what's taken place. At this point, they become a little bit more like a pro, especially when it comes to going to the dentist. They kind of know what to expect. And with this one, they're able to follow directions. You're able to provide them with post-op instructions on the importance of good oral hygiene, and they're able to take those and hopefully put those to good use. So with this, again, as an adolescent, they're oftentimes coming back by themselves, able to communicate with you if they're having any issues or discomfort or pain, and they're able to just, interact with you on a different level. Next one is going to be behavior management. And like I mentioned before, that first impression, especially with a dental office, can stick with that child for a very long time. And it's something that can even, stay with them until they're an adult. I think I've shared with you a nephew that is very fearful of the dentist and has to be sedated to do a very simple cleaning just because of his bad experience that he had as a child. So that, those are real fears that people have, and we have to be, supportive. We have to be encouraging, and, again, just being a person that they can look to trust, hopefully. So with this, many offices often use some sort of behavior scale to evaluate the behavior of the child, and that again is going to determine, whether this child needs to be in the private treatment room, or if this child is able to be out in the open bay area with the rest of the children. So with Frankel's scale, what they do is, it's a scale of 1 to 4, with 1 being definitely negative, to 4 being definitely positive, so, and then in between. So obviously if you have a child whose behavior is a 1, then those are definitely the children that you're going to have to spend a little bit more time with. You're going to have to, they're probably at least initially going to be having treatment done in the private treatment room, and then hoping that you can get them to a point where they're able to be a 3 or a 4 as they maybe get a little bit older or get a little bit more familiar with you. Then that's definitely something you want to strive for with those children that are maybe a little bit uncooperative or might be a little bit more apprehensive. So make sure you know all of the different ages, what those age from chronological, mental, emotional, what those mean, the different stages of Erickson's development, and then also Frankel's scale and what that entails.